are discussing the ergonomics of laparoscopy surgery. So basically the term ergonomics is derived from the Greek word that is ergons mean work and nomos mean natural laws or arrangements. So ergonomics is the scientific study of people at work in terms of equipment design, how their equipment is designed and their workplace layout and the working environment and safety and productivity and training. In simple word, if you know the word ergonomy means that the science that best suited the worker to his job and to make the setting varies and surrounding favorable for the laparoscopic surgeon. Okay, interface between the man and machine to improve the task very easier. So first, why ergonomic is very important in the laparoscopy surgery. Everybody is known in open surgery there is a very good aggressive high degree of freedom. So first options, there is a high degree of freedom. Surgeon is work along his own visual axis. It doesn't depend on anything. There is a three-dimensional direct vision, that is the depth of perception, and see he is getting a very good tactile direct feedback sensations at each and every step of the surgery. And here you can see in your laparoscopy surgery the difference from the open surgery is that in the open surgery there is only open surgery there will 360-degree movements anytime anywhere you have to go, any movement you need that is done in your open surgery. But in your laparoscopy surgery there will be only up and down up movement and down movement and sideways movement. There is no 360 rotation and rotational movement. And counterintuitive movements means when in laparoscopy surgeon when you move down, when you move the instrument down, the instrument cutif is moved off, so that is called as counter opposite movement of will be happens. Okay, and another thing is there will be a 2D image, but you are doing in your phone is 3D, no depth perception, no tactile feedback. So very important. So these are the things to improve that in your laparoscopy surgery. So ergonomic is very important. This is the science that making the setting and the surgeons everything is favorable for the surgery. Okay, so first thing is the surgeon stance. Surgeon stance has to be, these are the based on the three principle. One is straight line principle, one is low lying table below elbow height and gaze down view. Okay, and the port positioning is based on the triangulation concept, that is if ipsilateral port placement is done, and baseball diamond concept if it is contralateral port placement is done, and manipulation angle and azimuth angle and elevations angle. See, these are the point you have to remember. So first is your tower self or straight line principle. What is this straight line principle is telling about? Typically when your target is here, this is if you this is the target of your surgery, and the surgeon is standing here and the monitor has to be in a same line. The surgeons and the monitor and your target tissue has to be in the same coaxial plane, and the laparoscopy tower should be straight ahead in line with the instrumenter, this is the motor axis of the patient surgeon, so it should be in the same axis, so that that will cause less strain and difficulty, neck extension and hyperextension flexions. So most comfortable position, and the monitor should be showed as a down gaze, that is 15-degree downward. Okay, so that comfortable view direction will be gettable. Next is OT table height. The proper table height keep the surgeon's elbow and the arms adducted at his own operating table make comfortables, especially that will be very important during your intercorporeal endosuturing. The maximum range of movement is required. So basically the table height in open surgery is almost the table height is at the elbow height, but in your laparoscopy surgery the table height is at the level of thigh. Optimal table height during laparoscopy surgery, the ideal height is such a that the umbilicus of the patients is 70 to 80%. Umbilicus of the patient is 70 to 80% of the surgeon's ground to elbow distance. That is, if you calculate this is the surgeon's ground to elbow distance, then 70 to 80% has to be at the level of umbilicus, the height. So so that the table height is in such a way that at the level of thigh. Then OT table height, in that the laparoscopy instrument are longer than their open use counterpart. So table height should be adjusted in a fashion that they can work as a type 1 fulcrum. That is laparoscopy instrument handle after the instrument have been inserted in the port are at or below the level of the surgeon's elbow. And the angle between the upper and the lowest arm should be 90 to 120 degrees. If you lowering the table, if you lowering the table, it is difficult in some case, so need to some cases the tables not going down, so you can use lifter block or any some uh, blocks. You stand on the block. The recommended table height should be the height of the persons, the surgeons who is doing the surgery, into 0.49 into height of the surgeons is the recommended height in meters. So a height of operating table should be adjusted between 64 to 74 77 centimeters, so that it will be better. Okay. Then surgeon stance, already I told the monitor size, viewing distance. Basically, the viewing distance has to be not so far, not so near, so that will cause more strain or more contraction to the extracorporeal muscles. So distance should be ideally 60 to 80 centimeter. The distance should be this much. How we will calculate the distance? It is typically based on the monitor size. If it is a big monitor, then the size of the distance also far. And basically the size depend on the diagonal diameter. Is suppose if the diagonal diameter of the monitor is x, the distance from the monitor to the patient's surgeon's IU should be 5x. Okay. And it should be a 50 to 40 degree down gaze view. Okay. If it goes off gaze, that will cause neck pain. So very important statement. Next is your monitor positions distance. I already told that is it should be a zero point 0.9 average. If you think that is 0.9 to 3 meter between the monitor and the surgeons, that is 14-inch monitor. Maximum view distance increase based on the monitor size. Usually it is 5 times the diagonal length of monitor. At this distance, image formations of readiness optimal. Maximum acute color perception is good also. Okay. The standard distance. Okay, because the everything eye strain, irritations, blurred visions, headache. Okay. Then patient positions. Patient should be placed in low literally position with head down, trundling positions, and the legs appropriately supported in stirrups padded to avoid nerve injury. Thighs should be kept in neutral position, that is maximum flexion is 90-degree, and the hip maximum flexion is abduction is 45-degree, and to avoid injury obturator, femoral, sciatic nerves. Arms should be tucked in the side, should be in pronated, supinated positions, and to avoid compression of the ulnar nerves. The cameraman is very important persons because this is the eye of the surgeons standing on the same side of the patients, because sometimes in the sometimes the cameraman and the surgeon same side, that will difficult the surgeon to prevent from working in reverse at an angles. So in pelvic procedures, usually the surgeon is typical stand on the left side and the assistant stand on the right side. That will help better. And the cord tubing should be, you have to do cord time to prevent tangling. It should be if only enough cord length without an excess, and the suctions everything should be around up the head of the bed away from the surgeons. And the insufflation tubing, very important. After everything is set up, is done, trocar deployment and access of surgery done, the tubing, insufflation tubing should be placed on any trocar other than camera trocar, because you know the CO2 and CO2 will cause fogging of the camera, so which is minimize its cooling effect and consequent lens fogging. So basically you have to put the insufflation tube other than the camera port, so that it will prevent, for if you put the insufflation tube in the camera, that will cause fogging. So you have to put other than camera ports, that will cause decrease lens fogging and minimize the cooling effect also. And very important, the foot pedals in the electrosurgery, because best to use hand control when possible. Pedals should be placed near the foot, very important. It should be near the foot, aligned in the same direction of the coaxial alignment of the instrument axis and towards the target quadrant and the laparoscopic monitor, so that surgeon should not twist his whole legs during the procedures or surgery. The pedal with a built-in footrest is preferable. There should be a footrest so that the surgeons food should not be in the air in between activations. And the port positions is the baseball diamond concept, and the triangular concept will study in the next video. Thank you.